Hello everyone, I'm Julian Johnson and this is my synthesis project presentation. I did mine on improving glycemic control in adults with diabetes through technology-based supply management in the home health setting. So the purpose of this presentation is to determine if technology-based supply management systems affect the A1C levels in adults with diabetes who are receiving 24/7 home health care. It is important to maintain proper supply management in the home health care settings for optimal glycemic control. In the United States, diabetes affects over 37 million adults and is a leading cause of complications such as cardiovascular disease, kidney failure, neuropathy, and amputations. Poor diabetes management increases healthcare costs, with national expenditures exceeding $300 billion annually. Patients who suffer from diabetes often require continuous care outside of the hospital. Home healthcare nurses can be beneficial in the management of diabetes. However, inefficient supply management can result in worsening blood glucose control from missed insulin doses, improper glucose monitoring, and delayed treatment adjustments. Technology-based supply management systems for the home health care team offer supply maintenance improvements compared with traditional paper-based tracking systems. To address the problem, here's how we can explore it. In adults with diabetes receiving 24/7 home health care, how does using a coordinated technology-based supply management system compared with manual paper-based tracking and ordering of supplies affect A1C levels over a 6-month period? For my literature search, I use several databases as well as keywords that include home health nursing, diabetes, technology-based supply management. For the inclusion, studies were conducted in the United States and within the last 5 years. For the exclusion criteria, this eliminated pediatric populations and non-peer-reviewed sources. And for the final selection, it did yield a total of 9 sources that included randomized controlled trials. Across 9 US-based studies, consistent evidence shows that digital diabetes interventions implemented in home and community settings improve glycemic outcomes, patient adherence, data accuracy, and engagement. Improved A1C levels was the most commonly reported outcome, with reductions ranging from approximately 0.38% to over 0.60% across multiple RCTs and quasi-experimental studies. Practice-based studies of digital dashboards, home A1C testing systems, and supply tracking tools also demonstrated clinically meaningful A1C improvements. Even studies not focused explicitly on glycemic reduction found improvements in accuracy and consistency of home-based diabetes monitoring that indirectly supported better glycemic stability. A second major theme was improved adherence and self-management behaviors associated with digital interventions. Home A1C testing with digital reporting produced more consistent self-monitoring routines and feedback-driven adherence behaviors. Automated testing systems reduced missed results and increased reliability of home monitoring. Digital coaching models improved patient engagement and supported sustained diabetes self-management. Supplemental digital dashboards also improved medication adherence and supply readiness among older adults in home health settings. Accuracy and reliability of diabetes data improved across multiple technology types. Bluetooth-enabled glucose meters reduced user error and increased the proportion of complete glucose logs. Digital dashboards improved accuracy in supply tracking and reporting, enabling more effective clinician review and intervention. Patient satisfaction was consistently high when tools were easy to use, culturally relevant, or offered personalized feedback. Participants appreciated the convenience of home A1C testing, especially when supported by clear digital instruction or automated features. All studies demonstrated feasibility for home health integration, showing that digital diabetes interventions are compatible with remote monitoring workflows. Digital interventions were successfully implemented in diverse populations, including Black and Hispanic adults, supporting applicability across high-risk groups. Common limitations included short study durations, small sample sizes, non-randomized designs, and reliance on self-report measures. Despite these limitations, the consistency of findings across study designs support the conclusion that digital tools meaningfully enhance diabetes self-management in U.S. home health and community settings. The population of interest is adults with diabetes receiving 24/7 home health care in the United States. Key characteristics include type 1 or type 2 diabetes, an age of 18 years and older. Adults with diabetes often require insulin, continuous glucose monitoring, and other supplies that must be carefully managed to maintain glycemic control. Additionally, this population often has comorbidities that can complicate care and increase the need for precise supply management. Home health settings with diabetic adults are ideal for examining the impact of technology-based interventions because they introduce unique challenges, including variability in caregiver training, patient adherence, and logistical coordination. The intervention is the implementation of a technology-based supply management system across the home healthcare team. These systems often include automated ordering, digital reminders, and dashboards accessible to nurses and patients that track insulin, testing supplies, and other diabetic supplies in real time. Technology-assisted self-management interventions can improve A1C levels through improved adherence, monitoring, and timely adjustments to care plans. Home-use A1C monitoring combined with digital tracking systems has been shown to reduce mean A1C by up to 0.38% over 6 months, with low compared to high A1C measuring how well glucose was controlled during that time. Such interventions also improve patient satisfaction and participation. The comparison group is adults with diabetes receiving standard care with manual paper-based tracking and ordering of supplies. This is a traditional method and relies on nurses or caregivers recording supplies in paper logs, making phone calls to pharmacies or suppliers, and manually reconciling inventories. This system often has more errors, missed doses, delayed deliveries, and inefficiencies that can compromise patient safety and glycemic control. Research reveals that manual tracking often results in higher rates of non-adherence and poor A1C outcomes compared with automated systems. Some patients can manage manual tracking, but the risk of human error is high, especially in populations with multiple comorbidities or complex medication regimens. The primary outcome is glycemic control, measured by changes in hemoglobin A1C over a 6-month period. Hemoglobin A1C is a widely used biomarker for average blood glucose over approximately 3 months and is considered the gold standard for assessing long-term glycemic control. Studies show that technology-based interventions consistently result in greater reductions in A1C compared with standard paper-based care. The time frame for assessing outcomes is 6 months. This is the approximate duration of red blood cell turnover reflected in hemoglobin A1C measurements to note meaningful changes in glycemic control. This period of time is sufficient to evaluate adherence, supply delivery, and system usability in a home health context. while longer follow-up could provide additional insights into sustainability. 6 months is sufficient to detect initial improvements and inform policy decisions. The proposed change value structured phase change driven by leadership and measurable goals that is reflected in Cotter's 8-step change model. The model emphasizes on establishing urgency, forming a guiding coalition, and communicating a shared vision. Its stepwise approach supports change, preference for organized, transparent implementation, and is well suited for technology-driven practice changes in healthcare. The primary outcome for evaluating the proposed EBP change is hemoglobin A1C because it is the gold standard indicator of glycemic control and has been shown to improve through technology-based diabetes management interventions. Secondary outcomes include medication and supply adherence because digital platforms improve adherence and reduce errors in home-based chronic disease management. Another outcome is frequency of supply shortages, and digital supply management interventions have been shown to reduce through automated tracking and alerts. Digital system engagement like logins and alert responses will be measured because increased engagement is associated with improved glycemic outcomes. Finally, patient and nurse satisfaction will be evaluated because studies show high satisfaction with technology-supported diabetes tools in home and community settings. Hemoglobin A1C values will be taken at baseline and at 6 months using home use A1C kits or laboratory values documented in the home health record, like with prior home-based A1C intervention trials. Supply adherence and shortages will be automatically recorded through the digital system since automated tracking improves accuracy and reduces human error. Medication adherence will be measured using digital glucose meter uploads and nursing documentation, an approach validated in multiple telehealth diabetes trials. Digital system engagement data will be collected through platform analytics, which have been shown to correlate with improved diabetes self-management outcomes. Satisfaction will be measured with post-implementation surveys because patient-reported outcomes are an important component of evaluating technology usability and acceptance. A paired t-test will be used to evaluate changes in hemoglobin A1C before and after implementing the digital supply management system because this test is appropriate for comparing two related measurements in the same group over time. Home-based A1C monitoring should be integrated into routine diabetes care because multiple studies show that at-home A1C testing with digital reporting improves glycemic control and enables early detection of deterioration. Real-time digital feedback systems such as Bluetooth glucose meters and automated messaging platforms should be adopted because they consistently improve adherence and reduce A1C. Health coaching, including nurse messaging, pharmacist support, and behavioral therapeutic apps, should be included in chronic disease programs due to strong evidence and coaching improves engagement and glycemic control. Digital dashboards and supply management tools should be implemented in home health settings because they improve accuracy, prevent supply shortages, and increase patient engagement. Culturally, tailored digital interventions should be used to address disparities in diabetes outcomes, particularly among Hispanic and minority populations for whom tailored digital content has demonstrated enhanced engagement and improved glycemic outcomes. Effective management of diabetes in 24/7 home health settings is critical for patient outcomes. Technology-based supply management systems research shows advantages over manual paper-based methods, including improved adherence, more timely supply delivery, and measurable reductions in A1C over 6 months. Implementing these systems in the U.S. adult home health populations has potential to improve patient outcomes and support nurses in providing high-quality care. Future research should examine long-term effects past 6 months for adults with diabetes.